When it comes to going to the doctor, more Americans than ever are skipping visits or delaying them because of money.
And medical experts say that's the worst thing you can actually do. In fact, it can cost you more in the long run. Eva Anderson has the story.
At Allina Health West St. Paul Clinic, Dr. Alex Vizuni looks forward to welcoming patients.
I want them to feel comfortable sharing whatever they need to talk about, whether that's a medical problem, whether it's a concern they may have about housing, food, other resources.
But sometimes their concern is the cost of the visit, causing some patients to delay walking through the doors.
I certainly have some patients, particularly who have high deductible plans, who've tried to stagger out some of their visits, or who've been mentioning that they've paid off a bill or they're waiting to pay off a bill before they can come back and see me.
A new Gallup poll reports last year, 38% of Americans surveyed said they or a family member put off medical care due to cost, the highest on record. Aside from the obvious health consequences of delaying care, Dr. Vizuni says it can be even more costly.
If a condition progresses where now it becomes a more serious or urgent issue, that can mean that we're looking at an emergency room visit, a higher level of care, like a surgery, more intensive antibiotics, or a longer course of therapy, and that can just bring up the cost for a patient.
So while inflation is still high, she encourages everyone to look for ways to reduce the cost of medication and care while still prioritizing your health.
Checking out the cost of drugs at either goodrx.com, costplusdrugs.com, asking their insurance if they get a price break for a 90-day supply or a mail order versus a bricks and mortar supply. You can look at the cost of imaging on websites like Turquoise Health to see what the cost of, say, an MRI might be at different facilities close to you.
She also says make the most of your visit by preparing what you want to talk about.
It's really helpful when patients prioritize the top 3 things they want to talk about so we know that we hit that.
Dr. Vizuni, who also serves as the president of the Minnesota Academy of Family Physicians, says your pharmacist can also be your ally. So be sure to reach out to them about your most cost-effective options. Eva Anderson, KARE 11 News.
Great tips there. And to save time and money, the doctor also recommends telehealth visits. That got super popular.
Yeah, she says they aren't appropriate for every visit, but in some cases you can avoid waiting in the doctor's office and you won't have to take time off from work. I know those rose in popularity during the pandemic. Very, very convenient, those telehealth visits.